Hi, my name is Dr. Suvin Banker. I'm a gastroenterologist with Baylor Scott and White Medical Center. Today, we'll be discussing the topic of bloating. We'll be going over common causes for bloating. First, Dr. Bahara will discuss constipation and irritable bowel.
Hello, I'm Dr. Rama Bihara. I'm a gastroenterologist here at Baylor Scott and White, and I'm here to discuss a topic in relation to a common symptom that we all experience at one point or another, bloating. And bloating in relation to our GI realm is very vast, but in particular, I'm here to focus on issues in relation to constipation and, more importantly, a term called irritable bowel syndrome, or for simplicity purposes, we'll call it IBS. So to discuss bloating, you want to think about, well, how common is it? In individuals, it's estimated anywhere from 10 to 30%. And it's a frequent complaint. In relation to that, we have patients who commonly come in and will express the idea that as the day's gone on, they feel like their abdomen is just getting bigger and bigger, or even some patients who describe themselves feeling pregnant because that's how much gas, distension, or feeling of air that they feel in their belly. So when we speak about that, one of the more common associations that we see with bloating is in relation to constipation. Now, one may think, well, how does gas and constipation work? Well, in simplicity purposes, one of the more common reasons why we'll see that is simply because there's not movement of stool in the colon. And so as a result of that, gas builds up. Now, when it comes to that, there's different reasons for it. When we think about bacteria in your colon is normal. That's part of your gut flora. And as a result of that, sometimes that bacteria can result in disruption of gas, and that gas can rise up and cause some sensation of distension. And the difference is that there's a component of distension and then there's bloating. So bloating is the feeling of the gas in your belly, whereas distension is that measurable distance in your belly, the one where you feel like it's stretching your jeans or pants and you feel as though it's causing you to feel very uncomfortable. So it's more of a terminology issue, but it's essentially the same issue. So we talked about the idea of gas and the bacteria. Well, how are the bacteria affected in the colon? So if stool sits in the colon, then the bacteria has the ability to interact with each other and release this gas. There's also another idea called the brain-gut interaction. That's a very common and now more formally, more research topic. And what's happening with that is everyone has some degree of stress in their body, whether it's physical stress, psychological stress, emotional stress. All of these types of stressors channel in the gut. And as a result of that, it can affect different things like the motility of the passage of stool. It can affect the idea that the gas can stretch and cause stomach distension. And so when this happens, it can get very uncomfortable. In fact, when it comes to the term IBS, studies have shown that anywhere from 60% to 90% of folks suffer from bloating. Now, what does IBS mean? It's essentially that you have a disrupted movement of stool in your colon, and it's associated with pain at times. But interestingly enough, bloating, even though it's one of the more common reported symptoms, isn't needed to diagnose that terminology, but we often associate the two. Again, when we talk about this distension, we're looking often at times to ask that question: what are your bowel movements like? Are they irregular, such as you don't have them every day? or you go maybe a little bit, but you feel like you can empty out more than what you typically do. On the opposite end, there's also the terminology of going too much. So when we look at IBS, we talk about irritable bowel syndrome, constipation predominant. We talk about irritable bowel syndrome, diarrhea predominant. Most patients who have bloating and distension typically associate with the constipation. In addition to that, it seems as though the studies have suggested that women are more affected than men with regards to that. So when I'm seeing a patient in the clinic and I'm talking to them and they're presenting with issues that they describe, like bloating-like symptoms, often one of the more common things I'm going to be asking them is, what are your bowel movements like? And when you gather more information that, then we start to tap into, well, how long has that been happening? And then you start getting into more involvement of, well, what about it that started back then that led to that? So oftentimes in GI, we're seeing issues that may start with bloating, and then we find to be that it's actually the bowel habits that are causing the problem. And then we root back to what led to the bowel habit issues, and it could relate to a psychological, emotional, or physical stressor. So even though we're trained to look at the GI tract, more often than not, we're tapping more into the psyche and understanding as to what the root cause of things are, because at times when we're trying to look for reasons for what the bloating is, it may go back to something that you wouldn't even think about in relation to food or what you ate or what your bowel movement's like, but rather a certain type of event that affected you in your life, or something that maybe was a buildup of events, some form of trauma or stress, like I mentioned. So we talk about that. We talk about diet as well. Oftentimes when patients are constipated, they feel the first thing they want to do is add more fiber, because fiber is good for you. Fiber will help move things along. However, what's sometimes a little tricky about that is fiber actually can disrupt the gas and add more gas to the picture when you're already constipated. So many times in that setting, it may not be ideal and actually may be disrupting or causing more problems. So when we talk about diet, we talked about stressors. There's the components of what we call leaky gut, which is often associated with the bacterial inflammation. More of a microcellular level of how it's understood, whereas trying to treat it or address it is a little more difficult, but we know it exists and we know it's sometimes in relation to the bloating. Often as well, there's the idea of going back to the diet component. There are some foods that may be triggering. These are called at times FODMAPs, and what that means is FODMAP is an acronym that means fermentable oligsaccharide, disaccharide, monosaccharide associated polyphenols. Simply put, FODMAPs. Those foods can lead to disruption of gas as well and lead to an oftentimes change in bowel habits as well. So we've talked about some of the causes in relation to irritable bowel syndrome and how constipation may lead to the gas disruption. Let's talk about treatment options. There's a whole lot of spectrum of treatment options that can be addressed that, we try to curtail to the patient itself. Many patients aren't fond of medications. Many patients aren't fond of dietary changes. It varies from person to person. When we talk about certain things, let's talk about diet. So we talked about the FODMAPs, that may be highly fermentable foods that may be causing gas disruption and a change in bowel habits. Well, there's a specific diet that's been shown to be beneficial in patients with IBS that may help with bloating as well. And that's called a low FODMAP diet. It's been well studied and proven for irritable bowel syndrome diarrhea, but in many times we'll find this successful in utilizing for any form of bloating in relation to bowel movements. So it may be part of the picture. I mentioned avoidance of maybe fiber initially until those bowel movements are regulated, but that is something to consider as well. Medication-wise, there's a whole slew of medications out for IBS. For irritable bowel syndrome with constipation predominance, one of the first line treatments we'll use is a laxative. More commonly, you'll find over-the-counter Miralax, which is what we call an osmotic laxative. What that does is it brings water into the colon to soften up the stool, so it promotes passage, and in turn, the gas may be relieved that way. However, there's some individuals in which Miralax just doesn't cut it. It's not as strong, it may not be as effective, or they just simply don't want taking it. Well, there's some pill formulations that we utilize for IBS. There's different types of ones that work on the receptors in the gut. Ones like Linzess or Amitiza or Trulance or common medicine names that you may have heard of. These are not necessarily laxatives, although they contain laxative properties, but more so they work on the channels that release water into the colon in addition to affecting the nerves. So that goes back to what I mentioned about how the nerves can be hyperexcitable in the gut, and they work to regulate those. Although irritable bowel constipation is the more commonly form of IBS that's seen with bloating, there are treatments for irritable bowel syndrome diarrhea as well. There's medicines like antibiotics, one called rifaximin, another one called Viberzi. These have to be taken into consideration because certain people may benefit from certain medicines. Other times it may not be beneficial to use these. If some individuals are not keen on medications, not keen on prescriptions, there are some herbal supplements that have been shown to be beneficial as well in treating IBS. One being peppermint oil. Another trade name for it online or at the store is IB Guard. That is a good herbal supplement. It's purely peppermint oil. And peppermint oil has been shown to treat in larger studies in treating IBS as well as constipation. Downsides to that may be because it's mint, it can result in reflux and sometimes some stomach upset. So it's something to consider as well. There are some droplets that are available called Iberogast, which is a combination of different herbals as well. So generally, these are options for certain individuals. It may or may not be as effective. It just depends on what the patient or individual is receptive to. So we talked about medications. We talked about diet. What else can be effective? Well, we talked about how stress can impair the gut, how different stressors can do that. Well, how do we tap into that? There's different ways to approach it. There's, mindfulness. There's meditation. There's a lot of rule for, psychological therapy even, or cognitive behavioral therapy. There's been shown studies that it takes a combination of different practitioners to help tackle an issue such as IBS. That may involve a psychologist or psychiatrist. That may involve a psychiatrist prescribing something like a low-dose antidepressant that may affect the nerves or the gut as well. There's also some degree of hypnotic therapy, cognitive behavioral therapy, exercise. Exercise is very key in helping mobilize the stool and the colon. Staying physically active is very important in producing lifestyle, and adequate water intake when you're actually doing the exercise so that things don't get backed up as well. So in the grand scheme of things, we know that bloating itself is a common feature that we see in our practice, but many times can be rooted to your bowel habits, and in particular constipation, but in more seriousness as well, irritable bowel syndrome, which is more of what we call a functional gastrointestinal disorder, rather than being something that can be at risk for anything more serious, such as a cancer of any sort. So there's different ways of why it occurs, and there's different ways of how to manage it, but certainly seek attention from your provider or specialist in the event of this issue being a problem, and we or other practices are happy to help take care of it.
Now I'm going to introduce Dr. Surku, who will be talking about gastroparesis, which is a slowing of the stomach, H. pylori infection, as well as small intestinal bacterial overgrowth, which are common causes for bloating symptoms as well as abdominal pain.
Hi, I'm Dr. Nantha Sirkalingam at Baylor Scott White. One of the most common things that we get asked about is bloating. Bloating can be caused by many different things. One thing that could cause your bloating is a bacteria called H. pylori. People may talk to you about that and ask you, but hey, my friend had H. pylori. What is that? H. pylori is just a bacteria that sits in your gut. And for certain people, it could lay dormant for years. And as they get older, it starts causing symptoms such as bloating, pain, and heartburn. And one way to kind of check for it is through simple breath tests or through doing an endoscopy down the throat. These are all things that we do to find H. pylori. If you have H. pylori, it's a very simple treatment, and most of the times it's very effective. So getting treated and getting tested could potentially be one of the treatments for your bloating. Another reason why we talk about H. pylori is the fact that besides bloating, it can also cause things like gastric cancer. So in certain populations, such as South Asians, Indians, people from Asia and America, they can have a predisposition to H. pylori. So we like to test for it and treat it if we can, and also help prevent gastric cancer while treating your bloating symptoms. Another cause of bloating is actually another bacteria, or a cluster of bacteria called small intestinal bacterial overgrowth. Intestinal bacterial overgrowth is something that can occur in patients who are diabetic, patients who have constipation. Anything that slows down the gut promotes the idea of bacterial growth in your intestine. And with that, you got anaerobes, aerobes, going back to biology class, and all those things can cause fermentation of gas and cause you to have that sensation of bloating. So if you have something like bloating, we treat SIBO as well with antibiotics. How do we test for it? Once again, it's a simple breath test. There's no procedures that are needed for that. If you have that, it's like I said before, it's a quick treatment with antibiotics to see if that helps resolve some of your bloating symptoms. Another cause of bloating could be going back to the movement of your gut. Certain medications, diabetes, certain surgeries can all delay the movement of your gut. And when you do that, you can get something called gastroparesis. Gastroparesis is a condition that can cause the stasis of food, or the food being delayed in emptying your whole colon and stomach, and that in and of itself can cause bloating symptoms. Treatment for gastroparesis can be multifactorial. Sometimes it's medications, sometimes it's surgeries, sometimes it's stimulators that we place in there. But getting the diagnosis of it is the first step. And a diagnosis is through imaging, through endoscopy once again, to see if there's any retained food in your stomach that, hey, promotes that suspicion for the delayed gastric emptying, or gastroparesis as we call it. Overall, when people come to us and they have symptoms of abdominal pain, heartburn, abdominal bloating, if we don't find anything that's organic per se, we say we do things like upper endoscopies. We don't see an ulcer. We don't find H. pylori bacteria. We do SIBO testing and we don't find that bacterial overgrowth. We then look at something called functional dyspepsia. Functional dyspepsia is a broader statement of symptoms of the gut that are not ulcer related and did not have a true organic cause, meaning something that we can throw a medication at or do a procedure to fix. Functional dyspepsia is a cause of bloating, and that's why I'm bringing this up, is the fact that in the slew of food modifications, changing your bowel habits, all those things can improve functional dyspepsia. And so when you see your local gastroenterologist, these are some things you can talk about and say, hey, do I have this? Do I not have this? And like I said before, certain testing is very non-invasive, very simple, very quick. And the treatment for some of these diseases are a quick 10 to 14 day course of antibiotics. But seeing your gastroenterologist would be the first step in figuring out the next step in diagnosing potential causes of bloating.
Lastly, Dr. Khanna will cover celiac disease and food intolerances, which can commonly cause bloating symptoms.
Hello, I'm Sajanya Khanna. I'm a gastroenterologist at Baylor Scott & White. I'm here to talk about topics including celiac disease, lactose intolerance, and sucrose intolerance. Celiac disease is an autoimmune condition where your body attacks your small intestines and causes a variety of symptoms such as abdominal pain, diarrhea, and bloating. This condition has become more prevalent over years as the diagnosis has become more certain. In the earlier 2000s and 19th centuries, it was more a disease that was under the umbrella of autoimmune conditions with skin problems or diarrhea, but with more and more blood tests available and endoscopic diagnosis availability, the disease has become more diagnosed. It is important to identify symptoms such as abdominal pain, diarrhea, unexplained weight loss, and seeing a PCP, your primary care physician, as a first step would always help because it is vital to test before starting somebody on a gluten-free diet. This disease is as common as 1 in 100 population, and it is usually diagnosed based on blood test, but by the time you reach to a gastroenterologist, we usually recommend a test called endoscopy, which is a camera down your throat to make a diagnosis of this disease with more certainty. And there is also another entity which falls into the same umbrella, not exactly the disease, but gluten sensitivity, which is called non-celiac gluten intolerance. This particular condition, you may not have the actual disease, but you may be intolerant to something called gluten in your diet, which is commonly seen in wheat-based products such as rye or barley. And this also falls under the same symptoms as irritable bowel syndrome, which also has bloating, abdominal pain, and diarrhea. So it is very important to identify if there is a particular trigger, such as gluten. This disease is also associated with other autoimmune conditions. Hence, it is very important to approach this disease with a multi-specialty approach. This may involve skin, your joints, and perhaps this one disease amongst all the GI conditions is something that can be diagnosed in any specialist office because of its variety of presentation. So if you should be experiencing unexplained skin problems or joint problems or weight loss or bone depletion such as osteopenia, commonly referred as osteoporosis as well, which both indicates depletion of your bone material or bone density, you should be seeing a doctor and be tested for celiac disease. Next, I would like to talk about the topic about lactose intolerance, which is very common in general population and also has an overlap of symptoms with other common GI conditions. The symptoms are pretty similar to the other malabsorption or indigestion, sort of abdominal pain, bloating, or diarrhea. So this condition can be acquired, meaning it can happen in later stages of life, or it can be primary, such as from childhood. This is primarily because of lack of an enzyme in your small intestine that digests lactose, which is where we expect this particular carbohydrate to be digested. But if not, it can reach your large bowel and release gases that can cause discomfort, such as bloating or acidic stool or indigestion, increased flatulence, symptoms that overlap with, again, irritable bowel syndrome. Hence, it's very important to identify if you are intolerant to lactose. Intolerance to lactose is different from deficiency of the enzyme as such. So if you have any such condition or symptoms, it's important to see a specialist, a gastroenterologist, to identify if you're truly deficient versus you're intolerant, and perhaps if this disease is mimicking other major conditions such as inflammatory bowel disease that can simply present with an intolerance to lactose and with similar kind of symptoms. So the main element or aspect of seeing a specialist would be to rule out conditions that can have similar symptoms such as inflammatory bowel disease or even celiac disease. Sometimes this can be a temporary condition because of enteric infections such as parasitic infestations, which can lead to a temporary situation where you are deprived of the enzyme that breaks down the milk or milk dairy products. So in that case, perhaps a temporary prevention of lactose or limitation. The good thing about lactose intolerance is you don't have to strictly adhere to completely lactose-free diet, but if you limit it to a certain extent, you can still have relief of symptoms. The more uncommon condition is fructose intolerance, where there's not a lot of information. However, we do see a lot of patients being intolerant to high fructose juices or syrups. It is interesting because the beverages have a lot of fructose, but when they come in a combination with glucose, which they usually do, more glucose and less fructose causes less symptoms. But if there are certain beverages or foods with high fructose, there is immediately a set of symptoms of bloating or diarrhea. It is also seen in some natural fruits such as apples or pears, and something to keep in mind if you are experiencing symptoms within 30 minutes of having those foods, it's perhaps intolerance to fructose, and maybe have it with a meal, which usually reduces the symptoms of fructose intolerance. And the last condition that I would like to talk about is sucrose intolerance. This is primarily because of sucrase maltase deficiency, which is an enzyme which breaks down the complex sugar, which is the sucrose, which contains both glucose and fructose. So if there is an enzyme deficiency, it can be tested. All these malabsorptions can be tested with breath tests. And now in the market, there is medication such as sucrate, which is a replacement of the enzyme, which is recommended to be taken in 2 portions, one before a meal and one with a meal. Obviously, you would need to see a specialist to diagnose it and perhaps treat it if you're experiencing typical symptoms and if other overlapping conditions are ruled out. Diagnosing celiac disease is important, and differentiating it from non-celiac gluten sensitivity is vital because the cornerstone of this treatment would be strict gluten-free diet, and how adherent the person have to be with the diet is determined by the diagnosis. So with regards to gluten-free diet, it can be done individual basis because it's more accessible now and it's more affordable. However, we do recommend reaching out to a nutritionist. The first step would be seeing the specialist in the office, talking about the disease pathogenesis, getting a bone scan, and getting checked for nutrient deficiencies, because that's where major nutrients such as vitamin D and B12 get absorbed. And next step, seeing a nutritionist trying to get help with how to adhere with the gluten-free diet would be the key, with a 6-month follow-up to a 1-year follow-up to see symptom-free management as well as conversion of the antibodies to normal, sometimes a repeat endoscopy to see some resolution of the disease findings on endoscopy. Coming to lactose intolerance and sucrose intolerance, the main thing would be to sticking with the diet. With lactose, limitation of lactose would be sufficient, not particularly strict adherence. With sucrose, it's mainly about replacing the enzyme, hence seeing a specialist and getting treatment for replacement of the enzyme benefits a lot with the symptoms. With all the 3 conditions, the major key of this management would be diet, and we recommend to work with a nutritionist and a multi-specialty approach to maintain the comorbid conditions associated with diseases such as celiac disease. Thank you for your time, and please feel free to reach out to your gastroenterologist for any further questions regarding these food intolerances or celiac disease and how to seek help with regards to adhering to your gluten-free diet, etc.
Thank you for joining our webinar today. I hope you've learned more information about bloating and causes for it. Please visit our website, download our mobile app, or see your local gastroenterologist about further evaluating your symptoms.